Antimicrobial devices. So really important to utilize an antimicrobial around the insertion site and the catheter. So on the pictures on the left, we have chlorhexidine gel pads and then also chlorhexidine sponge discs, a couple different kinds. The pictures below show you actually want to put the slit, so I've marked that with the 2 red stripes. You want that slit right underneath the catheter, so that way it's easy to take off. If it's off to the side, it can make it a little bit harder. You want that slit right underneath the catheter. You also want to ensure that those chlorhexidine sponge edges are actually touching, and that's going to provide the best antimicrobial protection. Saline can be used to remove this chlorhexidine gel pads. It can make them much less sticky. It does make it kind of slippery though. If you put a little saline on there, it separates the gel pad from the dressing. And then the sponge is actually designed to stick to the transparent dressings. So when you're taking it off, if it's kind of tight underneath the catheter, just stretch that TSM dressing on each side, and that should pull those slits apart so you can bring it right off. And then just ensure that you're securing the catheter as you peel it back. So I like to use alcohol to loosen up the dressing. I work my way all the way around, get all those edges loosened up. If it's a 3-part dressing, you're going to want to take the top layer off first, then the second layer. Sometimes the layers will get stuck around the catheter. They'll be really sticky, so you don't want to expose that insertion site until you've loosened up the catheter around the securement device or the pigtails. So with this particular one, this wasn't put on correctly. It's wrapped around, so it's not really doing anything other than making it difficult to change this dressing. So I'm going to have to loosen that off and then pull that off. And I would want to get this done before I take off the rest of the dressing. So as you're taking the dressing off, you'll find those chlorhexidine gel pads can be pretty sticky. So in order to loosen that adhesive, you squirt a little bit of sterile saline on there, and those will come right off. Make sure you secure the catheter as you're removing the dressing, but that saline loosens that up. You can add a little bit more if you needed to. And then it comes right off. Sometimes it can make the gel pad really sticky, so it can take a little bit to get a corner, but once you have that corner peeled up, same thing, slides off the skin nice and easy. It won't stick to the catheter. If it does, you can add a little bit more saline to loosen it up. When we're scrubbing and cleaning the site with the chlorhexidine scrub sticks, you want to do a back and forth motion. You don't want to do light blotting or do a circular motion out from the insertion site. It's really just a back and forth scrubbing motion that you want to use. Scrub for at least 30 seconds, the whole area. And you can use a piece of sterile gauze to secure the catheter so you can keep your other hand sterile. But basically you want to secure that catheter as you're scrubbing so you don't accidentally dislodge it or irritate the insertion site. Try to avoid the catheter going in and out as you're scrubbing. Sometimes patients have different kind of tissue or skin, so keep that catheter secured and do a back and forth motion and try to avoid the catheter going in and out. If you find there's a lot of residue on the catheter, scrubbing towards the insertion site could help get that off without accidentally dislodging the catheter. Scrubbing away from the insertion site could cause that catheter to come out, especially if it's not secured. So we want to avoid that. And if you do accidentally dislodge the catheter, never reinsert the dislodged catheter. That's associated with a really high rate of infection. So when we're taking the chlorhexidine sponges on and off, putting them on correctly makes it really easy to take off. You want the slit underneath the catheter. The sponge is actually designed to stick to the tegaderm. You can pull the tegaderm side to side to loosen that up, but when you don't put the disc on correctly, so say you put the disc on the other side, sometimes what will happen is it'll get stuck around the catheter or that plastic piece designed to stick to the transparent semi-permeable membrane. It will come off and separate from the sponge. So put that slit right underneath the catheter, and then that disc is designed to stick to the transparent dressing, and then that way when the next person comes along to take that off, it'll come right off. So we want the window of the dressing to allow us to see the entire insertion site. So we want it to cover the securement device, we want it to cover the antimicrobial disc or gel pad, and we don't want the catheter edges close to the edge of the dressing. That second piece slides up underneath the pigtails and then over top of the dressing, and then if there's a third piece of the dressing, it goes right over top. That provides a nice seal, allows you to visualize everything. It'll be easy for the next person to get off. When we do the dressing changes, we want to note the external length of the catheter that's showing. If there's major differences between the last marking, that could be a problem. Also, I like to write when the dressing change is due next on the actual dressing, so anybody assessing it can say, yes, there's 2 centimeters of external length exposed, and the dressing's due to be changed in 3, 4, 5, 6 days. It doesn't need to be changed for 7 days unless it's soiled, loose, or dirty. And then also you want to document the dressing change in your interventions in the electronic medical record.